Hi everyone, this is Dr. Kusuma. Welcome to another episode of an educational interview that I have done before that many have found useful. So today we're going to talk to our lovely, talented Dr. Tatyana Borisiak, who is a dear friend first and foremost, a great human being who practices what she preaches and shares with patients. She is a board-certified internal medicine doctor who recently has taken a great passion and great interest in wellness, holistic preventative wellness care, not sick care, which is a paradigm shift in healthcare where you identify people early on, put them on the right path so she doesn't have to do sick care later on in their life, which is her transition in her career as well, which is a wonderful thing because we need more doctors like this who are going to transition from taking care of people after they're sick to somebody who's going to manage them at a young age and develop great habits, great activities, great care so that they never really fall sick in the first place and always feel good and look great. Okay, so that's the focus. Today specifically, we want to talk about weight management. It's nothing new for our practice, and Dr. Borisiak is going to go over why it's not new to us and why we are very, very focused on it this day and age, and how our office separates from the rest of the offices or what's happening in society at large because it's become a fad. However, we're a serious office. We take care of serious patients and we do serious work, not just a fad. So taking care of people in wellness, health is something that is what we do as a board-certified internal medicine doctor, as a board-certified plastic surgeon in collaboration. I'm not doing this myself because that's not my core expertise. My core expertise is cosmetic surgery. Her core expertise is aesthetic medicine, where she's board-certified in internal medicine, and she's the one that's going to oversee this entire program with me in the background, supporting her in any which way that she needs. Similarly, she supports me for patients that need medical care when I'm doing surgery. So this is a true partnership and a collaboration, and that's a main thing that I want to focus on because we're not just doing a weekend course to launch a new service. This is something that is our lifeblood. This is what we do as a core competence of our training for our entire life. So the focus of today's conversation is about comprehensive weight management in today's age. So having said that, Dr. Borisiak, so anywhere you look these days, there's weight loss discussions.
Absolutely.
Clinics are popping up everywhere that talk about quick weight loss on some membership program to put them on some medicines. And I don't know what happens after that, but why don't you walk our audience and patients through how you think about weight management, wellness, and your expertise in internal medicine that gives you an edge on how to take care of these patients the best way possible.
Hello, everyone. Thank you for Dr. Kusuma for such a wonderful presentation. And I'm really excited on continuation of this journey of our collaboration and taking care of our patients at best. As an internal medicine doctor, I started my journey a long time ago, taking care of sick patients at the hospital, further at the office, rehab clinics. And as I was getting older, I realized that
you are not getting older. You look like you're getting younger.
Thank you. I realized that it's not enough just to be a doctor for sick people. As a matter of fact, it's crucial to be much more than just being a doctor for sick people, because in nowadays medicine, a lot of focus had been spent before on once person gets sick, to take care of them, get them better, and then what? So I took a lot of time, a lot of research to educate myself and to implement that into my practice, to take care of myself, my family, and as well as my patients, to prevent them from getting sick. Today, our discussion will be mostly on weight management because it's most commonly talked topic at this time, so I can elaborate a lot more about internal wellness in the further discussions. But weight management is a very, very crucial topic at this time because it's foundation of all. If person feels well, they feel healthy, they feel motivated, they perform better at work, they perform better at life, they're happier. So it really, really reflects on their life and life of people around them.
So nowadays, it's something that, as we said, has become very popular to talk about weight management because of some new drugs that came into the market. It's
Correct.
almost to the point where it's ubiquitous. You know, it's now people are probably thinking about delivering these drugs, through delivery services, just like they deliver testosterone or something else these days for hair loss or whatnot, right? Or hair loss prevention with testosterone blocking medicine. So it's becoming too easily available, and I worry as a physician that it may get out of hand. So talk to us a little bit about the new drugs called Semaglutide, Ozempic, and Mounjaro, things like that. What are you doing? How long have you been doing it? And just give us some background about that.
Weight loss management had been a topic for the longest time, and it's almost like a fountain of youth. So fortunately, lately, everybody's heard about Ozempic, Mounjaro. Those are the most common brand name topics for the medications. Both of those medications were originally approved for diabetes management, and as a part of research, it was found that people were losing weight. So of course, now both of those medications are FDA approved for weight management. One of them is Wegovy, it's the same as generic Semaglutide, and the other one is Zepbound, which is tirzepatide or Mounjaro. They all are readily available right now as in a brand name, or a lot of compound pharmacies are making a generic version, and it is pretty much readily available. You can go online and buy a product.
However, who would give prescription if you buy it online?
There was actually they have a patient another day who said she was getting prescription from Facebook doctor, and there was no check, there was no blood work. It was a very, very brief interview. They shipped it to the house. There was no medication. And I see those patients all the time because in my general medicine, internal medicine practice, those people come into my office with concerns and worries and complications because those medications are amazing drugs. They're very, very helpful, but they need to be used with caution. So if you ever seek help with the weight management, you really, really need to consult your doctor because there is so much more to that. A lot of people have a perception that if you use the medication, you lose weight and everything is great, which is not true. I took an initiative and with a team with Dr. Kusuma to go much further and to almost perfect it to the point where we involved multidisciplinary team members, including dietitian consulting, meal planning, fitness trainers and coaches who would manage you, who would help you out, not just to get a simple shot, but to treat you from inside out. So as a patient comes in for our weight loss management, we perform extensive physical examination, detailed history, detailed blood work, to first and foremost optimize their health to begin with, to optimize their hormones, to optimize their electrolytes, to look for any diseases that could be contributing to that weight gain that they want to do. And only then, after we take all the biometrics as a base point, we then customize the plan individualized on the patient care. And we follow them really closely on a monthly basis. We educate them how to use medications. We follow their blood work, and we've been getting amazing results, because also I would like to say that it now becomes, I see more and more people who not just lost weight, but there is a question arises, what do you do next? Because patients lose weight, and then once you stop the medication, when you stop the medication, a lot of them going back to their old habits. So a lot of them lose weight significantly that they actually don't look good because they all have all this loose extra skin, they depleted of electrolytes, they're depleted of nutrients, and all those things, very alarming. And unless you have help of qualified professional, that you may be in trouble.
So I mean, what jumps out to me, right, is that when a caregiver, when a provider, when a physician, when a doctor starts a service, you have to always question, is this their core competence, and do they have core competence in this training? Did they spend their lifetime learning this care, or are they just doing it because they want to make extra money? It's something that I think everybody should think about. So in this case, like I said, Dr. Borisiak has the core competence in it, not me as a surgeon, so she's going to be leading it. And what jumps out here is safety. Safety can only come with the comprehensive knowledge that you need as a prerequisite to doing this, and experience taking care of hundreds and thousands of patients to know what to look for. So the first part that jumps out is safety. The second part that comes out is the competence and the background and the training and the interest, because this is what you do day in and day out. This is not some hobby for you on the weekend, right? This is the main thing. So the third thing that comes out is then what question. So you get some medication online, and then how do you oversee it? How do you manage it? How do you access your provider or your physician? What do you do after you lose the weight? How do you take care of your loose skin? How do you take care of your nutrition? And do you go back to your old habits after you stop the medication? Because clearly you don't want to take it for the rest of your life.
Absolutely.
And so what do you do about that? So there's a behavioral aspect to that as well that also has to be discussed. So talk to us a little bit about how you take care of this. What after?
So every patient that comes into our clinic, we own the patient. We adopt the patient. We go very deeply into their history, into their evaluation, to see what habits led to this weight gain. And we try to counsel them. On lifestyle modification, extensive counseling on lifestyle modification. We provide them with a meal plan and exit way out, absolutely. Because it's very, very important for someone who lost significant amount of weight to make sure they stay healthy, they stay safe.
Do they come to you generally and ask you, I want to be this weight, or do you recommend to them that this is the best weight for your body type, or is it a little bit of both?
So a little bit of both. We have patients who are severely obese, and we have patients whose BMI is normal, and they go to a doctor, to a regular practitioner, and they say, you're pretty healthy, you're good. But then they come to me, they say, I would like to lose weight. So those kind of patients, we have to be very careful, because we don't want to focus on a number. We want to focus on how they feel, on their internal health. Mm-hmm. Although there is a concept which is kind of new at this point, skinny fat. Skinny fat. When I have a person who's 5'1", 115 pounds, and they say, I want to lose weight. I'm like, why would you want to lose weight? And we put them on a body composition scan, which we have in both offices.
So let's just kind of slow down here for a second, because people need to follow this. So there's a concept, like the question was, do patients come with a number in mind that this is how much I want to lose, or do they consult with you and ask you what's best? And you replied that it's not just a focus on a number, it's about health always, right? And then you talked about the fact that there's something called skinny fat. Skinny fat, essentially, you're describing is that people are skinny and low weight, but they look fat. They may have gut fat, or they may have internal fat that makes them look unfit, although they're skinny and actually at a good weight. That's what you're talking about, correct?
Correct.
Yeah.
Correct. So there is a very easy way to do comprehensive evaluation of that patient. We have a body composition scan machine that takes about a minute to do the test. But it gives us really good idea and a baseline of a body composition, of how much fat person has, how much muscle they have, if they're retaining water, how much, and we would see if they have a visceral fat. And a lot of times I do see
visceral fat essentially means internal fat, correct? Yeah, not external fat. So for the audience, again, to understand the difference, there's fat outside of your internal body cavities, like the abdomen and etc. And it sits outside, and that's the fat that we remove, the outside fat, through liposuction. The visceral fat that's internal, we cannot remove it with liposuction, and that's the difference. Yeah.
Correct. So, and those people after we evaluate body composition scan, we would customize the weight loss plan or fitness. I would say more like a fitness and wellness plan for those patients based on what's their body composition and blood work and internal health.
See, because is there a scenario where for the skinny fat patients, which may be quite a few of them, in that situation, is it possible that they could be underweight if they get put on this because they lose more weight because they're already low weight, but they just look like the skinny fat version? So they could be underweight. So in that case, do they have to gain weight, you think, through muscle mass training?
Correct. And it's very, very important to focus on proper protein intake and proper muscle mass, because muscle mass is predictive factor of longevity and quality of life of anybody. As we get older, we do lose muscle mass. So as we see older patients who want to lose weight, and we put them on Ozempic or Mounjaro, and next thing you put them on a machine, and they're happy. They say they lost their weight, and when you look on the body composition, they actually lost muscle. There's a no-no in our practice. We try by all means to prevent that from happening. And we get very excited when I see a progress. Patient comes in, they say, oh, I gained weight. This medicine is not working. When we put them on a body composition scan, they actually gain muscle and they lost fat. And they feel better, their skin is glowing, they're sleeping better, and they perform better at work, at family, they have better libido. It's really, really affecting all aspects of life for the patient if you do it right.
So how do you factor in behavioral health into this to change habits so that when they get off of medicine, they stay the way they are?
It's an education. Again, we're going back to those patients that are skinny and fat. They come in and they have a number, say, doctor, I just want to lose 10 pounds, because they're all looking to that maybe college weight or high school weight, and they focus on that number. And that number is, and they put them on a machine, and there's nothing to lose. There's no fat, there's mostly muscle that's missing. So those patients require extra education, because you do not want to harm them by giving the medication. And that's what happens on the Facebook doctor.
Dial in, order online kind of
Correct.
stuff.
I had a patient yesterday who came in and he said, I was getting the medication from a Facebook, and she's 115 pounds. I'm like, okay, we're gonna talk about it, and definitely do evaluation and see what we can do. Those patients really needs a lot of counseling and guidance on proper
So do you
eating
follow them
habits.
after you take them off medications as well for general checkups?
Absolutely. And they, like I said, we own our patients, so they know where to find me. They know where to find our team. We're easily accessible for any issues that may arise, and follow them very closely. They have access to a portal where they can review they can put in their pictures, they review pictures before and after, they can follow the trend of their body composition scan and the blood work, and of course meal plans and dieting, that to put them on the right track as they go on in life.
So, I mean, there's a lot to talk about here. Of course, we didn't even touch the subject of the loose skin that people can have after losing weight, whether it's the abdomen, whether it's the breast, whether it's the face and neck. That's where I would come in again as a partner to kind of help them get rid of all of that and look great after they lose the weight, because they're feeling great. So there's a whole lot to discuss. We'll break it up into different segments. The next part of this, we'll talk about the plastic surgery changes called Ozempic face and Ozempic bodies that result from it, and we can talk about what we can do for that as a separate thing. But together, what we want to share with you is that at Suria Plastic Surgery, with Fuse Vitality, which is what Dr. Borisiak has built and worked so hard on, we are really joining forces to build a comprehensive wellness, nutrition, weight management center. We're going to launch this program, in a sense, that creates memberships where people can come in and can get their monthly checkups. Like she talked about, we have a team that includes a plastic surgeon, that includes nurses, that includes nurse practitioners. Of course, it's completely led by Dr. Borisiak comprehensively. We have a fitness instructor We have fitness trainers who are
we have the
professional.
whole team of fitness instructor and health coaches that work with us.
Diet plans as part of it, and we'll do this through our software Simplast that allows you access to visualize and keep track and communicate constantly, so that you're not somebody that's just a number, but you become part of the practice. And we will do our best to ensure that you get the most benefit out of it safely, with competence and with care and with compassion across your lifetime, because we want to keep all of you from getting sick. We want to keep you healthy and looking good and feeling great all the time.
Correct.
So the next part of the interview we will do, hopefully we can focus more on different aspects of it, and we'll do a series of them. The next one could be plastic surgery. Then we can talk about behavioral health. Then we can talk about diet, and we can even bring our fitness team and have them talk about the fitness training. So we'll kind of launch this for patient education as we go.
And if anybody has any questions, would be great to possibly do a sessions of questions and answers.
And we can do a webinar kind of thing where we can do a live question and answer seminar as well.
I think that would be a great idea.
Perfect.
Because big questions always arise and patients really getting more patients. What I would like to really note as well, patients are getting more educated overall because a lot of information is available on Google, and patients can buy products on Google or on Amazon or anything like that. So it's overwhelming amount of information, and we get some smart patients that know what they want, what they look for. But there is the reason why we are doctors, you and me, because this is what we do for a living. We constantly attend conferences, we constantly try to stay up to date on the latest technology, latest medications, and to ensure the best care that we can provide for our patient to keep you healthy, keep you well, keep you safe, and achieve this ultimate happiness, I would say.
All right, so this is a great partnership that we're going to launch and take care of you guys. So thank you for your attention, and we'll see you soon.
Thank you. Bye.